Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Rusty Yeager. He's Senior VP and CIO at Encompass Health. Welcome, Rusty.
Hey, John. Hey, everybody.
Great to have you back. I think last time you were just coming off your big win as CIO of the year, but now you're headed into a different area now, which is you're getting close to retirement. So excited to hear about your expertise. But for those that don't know you, tell us a little bit about yourself and Encompass Health.
Okay, good. So, as John said, CIO here in Encompass Health, we're an inpatient rehabilitation provider. So, we have 174 inpatient rehabilitation hospitals across the United States, in 39 states. And so, when you think inpatient rehabilitation, think post-acute care, and a very debilitating condition where you need care post-acute in the acute care hospital, you need to go somewhere. Our competition is the skilled nursing facilities, but we're a level of care above that. So I think if you ever have a challenge in post-acute care, give me a call because it's really hard to reflect on, and I'll be glad to help you. But we run all of our IT operations out of Birmingham, Alabama, for all the hospitals. We're pretty lean and mean, and we're for-profit organization, and that drives a lot of that. So that's that. On me, I think there's some opportunities to reflect on a couple things that did happen in my life, and it's made me, be better than I would have been without them. And one of them is challenging. So my mom died when I was 6. And when you think about that, I didn't know who my dad was, right? And I
Wow.
can vividly see her, unfortunately, in the coffin. And right then I said, this stuff is real. And so,
Mm,
as my friends in Rush say, you're only immortal for a limited time. I think if we all reflect on that, it can
wow.
drive us, every day to be better than we were the day before. The other thing that happened is a couple years later, gratefully, that my dad found someone that he loved, and she and him got married, and it's great. I have a stepmother, and that worked out wonderfully. But we had 4 kids in my family. Then we have 7 kids, and
Wow.
they were all over 10 years older than me. So what
Okay.
I got to do there is reflect on watching people grow up, because they were anywhere from like 13 to 18, and reflect on the choices that they made gave them consequences. So I really used some of the good and some of the bad that I saw with my siblings, to help drive me. Well, but I didn't really do that until probably after college, because I was having fun in high school, having fun in
Uh-huh.
college, and it's like, okay, now what are you going to do? And
Interesting.
so I decided I wanted to be in the Air Force and be a jet jockey or whatever. And turns out right before I was getting ready to go into the Air Force, they said, your eyes are terrible. You can't do that. What do you want to be? And I just really freaked out. And this was the most incredible thing that happened to me in that kind of regard. My wife was teaching school, and she knew a medical service corps officer in the Air Force. They said, you should try this. And I'm like, no, my mom died when I was young. I hate hospitals. I don't want to do that.
Hmm.
And, but I decided to do that because I love the Air Force. And that really set me on a great trajectory, working in first healthcare administration and then healthcare IT. And going through that, I also built a band of brothers that many of
Hmm.
you guys out there know. That is, so Wes Wright, Drexel DeFord, Randy Carpenter, Russ Branzell, JD Whitlock. Then there's probably 15 or 20 of us that were in the Air Force together, and we were driving each other. Right as the internet was coming out, and how are we going to build because we were putting in EMR systems way in advance of the civilian sector. So we learned a ton, and then we decided, this is some of them were retirement eligible, some of them weren't. Went into the civilian sector, and we've all made good impact. So those things were really um, lessons that I learned, and I think about them quite a lot. And that's one of the reasons why I'm retiring is, we never know when this thing's going to happen, and I can go give back to other places. I built a succession plan. The first day I took over as CIO, I knew who I wanted my successor to be, and I brought him here, and he's now going to be the successor. So,
Wow.
a strategy can really help you be successful. And it's so hard to think strategically today when we do phones all the time and it's all, bow, 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 bow. So those two things were pretty important to me.
Yeah. What an amazing story. Yeah, it's interesting you mentioned your siblings and kind of learning from them. I attribute much of my success to watching my siblings as well. And they paved the pathway so
Yep.
I knew what success could look like and how I could exceed them because they made the mistakes that in schooling and selection of schooling and how to do it. Not, my siblings are all,
Yeah.
they didn't do anything crazy, but
Yeah.
I learned from them and they taught me. They're like, don't do this, right? And it
Yeah.
helped me be more successful. So that's interesting. I credit my siblings, which I come from a family of seven as well, which is an
Okay.
interesting
Wow. Yeah.
connection. So I understand it well. That's awesome. Uh, you know, you talk about just that breadth of experience that you have in both the Air Force, but also, as a civilian, in various healthcare organizations. You've seen a lot, but what do you think like the greatest leadership challenges is for a healthcare CIO right now? Like, I'm sure you've been through a whole series of challenges, but what's the challenge today for a CIO?
Yeah. That's an easy softball, right? Because
Okay.
it's expectation management.
Oh, interesting.
Right. So, we did the EMR thing, and, in our particular case, that was a 7-year thing because we were going
Mhm.
around the country. So it took us a
Sure.
while. And then there was the EMR optimization. Okay, we can kind of just take our time and everybody's on board. Then bam, it's cybersecurity and all the chaos that can get to us. Let's spend our time and our money and let's fix that problem. At the end of that problem comes this incredible opportunity that presents a problem to us to be as adaptive as we need to be to keep up with that. And so we've got to change this organization that's really built on super process, super governance, and make it much more nimble, less, tech savvy, more process business oriented than it has been previously, maybe. And, reflect on how we can put these into infrastructures and processes that aren't necessarily up to speed or technology capable is everybody thinks they should be when they are at home using ChatGPT or whatever, or the vendor comes in and tells them, hey, this is all AI enabled and blah 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 stuff that we've got to reflect on. Where's the security, where's the governance, where's the trust that we're building with our employees who are the clinicians and their patients to make sure these are the right things. And that really builds a fabric within the whole healthcare system that you're working in, because we've got to be on the same page on this stuff, because I
Hmm.
think of it as it's another tool in the IT tool belt, but it's the most incredible tool we've ever seen. And, it's the tool that thinks for itself. And how do we make sure we know where the plug is? So if we have a problem, but ultimately there's no plug, right? And there's some good books about that, because I always thought, well, just pull the plug. Well, that's probably not the solvent for this whole challenge if it ever were to arise. So I think that's the most challenging situation that we're in right now. Our organizations, both on our clinician side as well as the IT to support that, have got to be malleable and adapt quickly to get the benefits that it provides. I mean, there's no kidding. There's administrative burden reduction, potential reflections of clinical conditions that wouldn't be seen by a human. We got to go.
Yeah. It's interesting because how do you lead in an environment where AI could impact everything? But the question is, what should we impact? and what's ready for prime time, you know, and then we have the classic IT problem of, hey, we don't want to implement 1,000 AI solutions. We'd
Yeah,
rather implement five of them, but right now there's 1,000. Like, how
that's
do you
right.
navigate that
Yeah.
as a leader?
So we have typically been very standardized as an organization, and there's a lot of debate about the value of standardization. But in our particular business, it makes a whole lot of sense because we do the same thing at 174 locations,
Mhm.
PTO each, and physician care of patients for, call it 12 days or so is a typical length of stay. So we have always standardized, and so.
Mm.
We started putting in, Oracle Cerner back in 2010 was our first hospital, and we finished up in about 2007. And then we started actually working with them to build out some machine learning AI. So
Mhm.
we kind of got a good feeling for it, but then it was just static. And we built another model to predict vols. Our first model was on acute care transfer. If a hospital, I mean, if a patient gets sicker while they're with us, and we need to transfer them back to reflect on, that condition. In fact, that's one of my things that I look so back on that was so compelling because I was sitting in a meeting and a business leader, clinical leader said, "Hey, if we could just drive this number down, we're going to really improve the patient quality of care that we provide, as well as affects the bottom line positively." And we had been on the I always call it Cerner, the Cerner platform for like 4 years, and I'm thinking, man, we got enough data in this thing because at that time we probably had 40, 50 hospitals. We ought to be able to predict this. And Cerner helped with that. And that one really helped us bring that number down, which is great for the patients, of course. And it was good for us from clinical quality perspective. And we took that and built a falls model. Our patients are up and around. So they're going to
Mhm.
PT 2 times a day, probably. We want them up and moving around. So they have a propensity to fall more than an acute care hospital.
Sure.
So in all of these things, we built a protocol that goes with the AI. Some people don't think of machine learning as AI, but it appeared to us to work. We didn't care what it did, and it's been incredible. So
Brand it however you want.
we standardize because it's good for us. And I'm a proponent, and we talked a little bit about this, that we're going to standardize on a single platform, and the workflow is so important in healthcare, especially in hospital settings, that AI in the workflow, I think will work really good. AI that you got to alt tab out to, not so good for the nurse, the therapist, the physician. Get that stuff up where they can use it, consume it right in the moment. So we're talking with Cerner. Typically, we're at the last of the capabilities that come out from the EMR vendors because we're the largest player in inpatient rehabilitation hospitals in the United States. Most of our other folks that do that are part of an acute care system, and they're using whatever system the acute care hospital is using.
Sure.
So when that comes, which they're assuring us that will come, that is probably the route we'll take. Build it into the workflow, make it as seamless as possible. And we're doing other things around the periphery. We've done some work with Palantir to reduce administrative burden and some of our other capabilities, and that has been wonderful. I mean, we had a process that was taking a couple hours for people to do, and we're doing that, a couple thousand times a day, and we've shaved 20 minutes off of that process, and made the life of those people much better, and the efficiency of the process that we're doing much better as well, and the quality. So I laud all the folks out there that are working on that. I laud the vendors for bringing that capability. It's super compelling. We just need to be strategic about it, make sure how it fits into our clinical operations, put the governance around it. And those are all challenging things. I know
Yeah.
all of you guys and gals out there are dealing with that. And I laud you for that. It's quite a task.
Yeah, tell me more about the Palantir thing. That's interesting. Is it leveraging the data from Oracle Health Cerner, and being able to improve the process, or is it kind of layered on top? Tell us more about that. How does it work?
Yeah, so initially we're working on things that surround. So we have a pre-admission screen for our patients. So if you're a patient and let's say you've had a stroke, we will send somebody out to evaluate you to make sure that you can tolerate 3 hours of rehabilitation care 5 out of 7 days a week. And that's
Wow.
the entry criteria for inpatient rehabilitation according to CMS.
Okay.
So we have a 7 page pre-assessment form that was on an iPad, and man, it's killer, right? Just pop, 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 do all this stuff. But then when you get a reviewer that looks at it, it's okay, how do I take all these different data elements that are on this thing and discern, the viability of this patient for inpatient rehabilitation? And one way you do that is you take that 7 page document and you look at AI to
Hmm.
run it through, and it says, here is the real reflection of the patient that's human understandable. So that was a real big win for us, and it's a real big win for our folks out in the field doing that. And of course, like most organizations that do the appeal letters and things like that, we're looking at where we're going to build new hospitals now with them. We're looking at some of the things that we do in our customer relationship management system. And then, of course, rev cycle. Our rev cycle is really pretty tight right now, but we are upgrading that to OPAC, which is Oracle Patient Accounting System, whatever. I don't know I
Uh-huh.
don't think there's a real lineup on the algo there. And so we will be Oracle Cerner shop from Fusion, which is their ERP, and to RevCycle, and of course Oracle Cerner. And we're excited about the things that we are going to be able to do to lower the administrative burden of doing all the interfaces and things, and also, our RevCycle system that we replaced and our ERP that we replaced were 30 plus years old.
Wow.
Like, I've been here 25 years and I wasn't here when they put them in.
Yeah, that's interesting. I'd love to hear that perspective around, is there as much value in having, the ERP and the EHR all on the same platform? I mean, we've heard Epic is announcing that they're building an ERP because of this idea.
Yeah,
Have you seen that value of having that nice tight integration between ERP and EHR?
we have not seen it really yet.
Okay.
So this is a, a strategy that we talked with them several years ago, and we're working with them to bring that to fruition. So, we do have interfaces between Fusion and RevCycle and Millennium, but they're routine old school interfaces. I think as Oracle continues to invest in the EMR, there'll be a platform there that it will be much easier to get, especially for once the EMR gets into the cloud, it will be sitting right next to Fusion, so the APIs
Sure.
can start to do their thing, and then I think OPAC will come in behind that. And those things, one of the things that drove this for us was I looked around our organization, and we had 50 over 50, so not 30 over 30. It was 50 people over 50
Uh-huh.
years old that were in very key positions.
Yep.
So I advocated to the executive team here, we've got to modernize our platforms and then reflect on that transition time. So that's
Mhm.
what we did. Let's go after, first we went after ERP, and then we went after RevCycle. The systems were working fine, but a kid coming out of school doesn't want to work on COBOL, right?
No.
They want to be a full stack engineer, AI this, whatever. And we were going to run out of ability to
Sure.
support those systems long term. So fortunately, the executive team got it. We made a slow but diligent move to the cloud. I ain't that smart. We've talked. So, my move to the cloud was slow.
Okay.
And the reason why is it stable yet? Is it financially good for us?
Sure.
It's a CapEx OpEx trade-off
Yeah.
that, in our particular case, we need to be able to signal that to our investors because there's going to be some switch off there.
Yeah,
But
absolutely.
I'm from Texas, and I know if you're sitting on a fence, what happens is not good. And so my reflection is, if you're going to do something, go.
Hmm.
A lot of times maybe a better situation is go slow, but we let it mature. And then once we see all you guys on the other side of the fence, we look at them, looks like a good place to meet, and we'll jump over the fence
There you jump.
and
That's
go
interesting.
fast. Some people, rusty speed, let's go.
I like that rusty speed.
Yeah, there's somebody coined that. I don't really like it, but I do like it because I think it's somewhat respectful.
Yeah, well, it illustrates how you're able to affect change, which I think is a powerful idea.
Yeah, if you're a explorer versus a settler, it's a whole different deal.
Yeah, absolutely. It is such an interesting environment. There's so much happening. There's evolution of technology. There's evolution of the people that we're working with and the people you need to be effective. Like, what do you think are some of the keys to leading a health IT organization effectively in this current environment?
So I don't think it's changed.
Hmm.
Let's go mission first and people always. Drucker said many years ago that the culture eats strategy for breakfast.
Yep.
But I also say too, you still need breakfast, which is the strategy that gets these things on the pathway for productive use. So I think you've got to spend, so there's a lot of fear, uncertainty, and doubt with the people, right? You drive to work in the morning, you hear them on CNBC talking about, well, why do we need any developers anymore and blah, blah, blah. And if you hear that and you're one of those people, you're apprehensive. So um, I think we need to spend more time with the people, reflect on where do they strategically fit in the organization, because what's left when we're buying AI agents for everything, right? And they just come in and they do their thing. What's left? Well, you still got to secure it. You still got to have a strategy for it. You still got to govern it, right? So you still got to do project management, but maybe you don't do some of these other things. So begin the pathway you know, for folks that want to make that transition, that they can transition to some of these other roles. And I've always kind of said to some of my folks here, we're a healthcare company and we do healthcare. We just happen to be the IT folks.
Hmm.
And if you want to be in IT, if everything you want to do is a science experiment, go to work for an IT company. I got no challenges with your thinking that, because long term, there's going to be a reduction of IT jobs probably in, organizations like healthcare institutions. And we have a lot of them. Everybody else out there, you guys all have a lot of them. Things are going to change for them, and it's only incumbent on us as the leaders of those organizations is to reflect on that, help those people because they've all given great things to our organizations, and make sure you can do the best you can to support them.
Love that. I love how reflective you are as you kind of look back at your career. Is there like a major lesson that you learned in your time as CIO, and what was the lesson that you could share with others?
I think I'm still learning them every day.
Hmm. So
But
that's the lesson to constantly learn.
well, that is a good one because you're much more malleable, in a change accepting. But I think the CIO sits with their feet in two camps.
Hmm.
They're on the C-suite, whatever that means, and they're in IT. And you need to be reflective of that, because if you're way one way or the other, I'm not sure you're going to be as successful as you can be if you can learn to play that.
Mm.
And so, I advise people to learn the business of the organization and then build trusted relationships within the organization with everybody that matters. And then you can build your culture consistent with what the organization wants. So I hear stories where, that, and this a lot is older, is IT was just over here.
Mm.
But everything that happens in a health system today depends on IT. And we're still going to be a valuable part of the organization. It may change a little bit, but it is such a significant thing that we have to bridge the gap. And
Yeah.
when they're thinking strategy in the C-suite, that you're lead turning them, saying, and they have, well, this is the problem we're looking at. I found a solution. Take a look at this here. Do you think this will help? So always have your antenna up, listening. Your people will be talking to you. Hey, read things that you read about your organization, because a lot of times your organizations get so big, maybe the place you learn some of your stuff is in the press.
Yeah.
And then start lead turning them. I really do enjoy when they say, hey, what do you think about this? Well, here's what I think about it, and here's how I think we can help.
Interesting. The longer I do this, the more I realize the value of being able to translate multiple domains. And I think that's true in almost every industry and almost every segment. Like
Yeah.
even in the media business, being able to translate what you as a CIO wants from healthcare IT today, but also what the vendors need and want, and being able to translate that. It's the same kind of principle. You translating what the providers need and what the patients need and what the IT needs as well is just so valuable.
Yeah, and one thing that is really, business leaders know how to calculate and accept risk. In
Mm,
IT, we want zero risk.
mm,
And so because we want zero risk, there's sometimes a divide between us. And that's one of the things I've worked with our team here. it they know it's not going to be perfect every
mhm.
time, because we do good work. Most everybody out there does good work. Sometimes, especially at the cutting edge, there's going to be challenge, and that's where I come in as the CIO to bridge that gap, to reflect to the C-suite. Yeah, we're going to have some challenges, and this is what they are. Otherwise, I think we're in a good spot. We should do this and be accepting of this risk that exists.
Yeah, I think where they get troubled is when you don't say that there's risk.
Yeah, yeah,
When they think
everything.
it's an easy implementation, no issues, we're not going to have any. It's
Yeah,
actually much better for them to think, oh, there is some risk and I'm taking this on. And, the
yeah.
like you said, goes back to managing expectations. Interesting.
Yeah.
As you look back, do you have a favorite story of a project, a situation, or an effort, whatever? I mean, something that you did in your career that you're like, really proud of?
Yeah, and I kind of exposed it earlier. The things that, so we didn't get the meaningful use dollars to put in an EMR. And our CEO at the time had come from HCA, and he
Mm,
reflected and was very prescient. Well, we get 93% of our patients from an acute care hospital. At some point, which is still not there yet, really, we're going to start getting electronic referrals, and we needed EMR to do that.
hmm
So we didn't get the money, but we forged ahead, and we put in Cerner, and that's why it took us some time. Is we just couldn't do the big cash outlay to do everybody at one time. So we did 5 hospitals, uh, 20 a year, so 4 different rounds until we got done, and then we're
Amazing.
growing. So we started this, we were at 98 hospitals, now we're at 174. So that continued it out. But the use of that data to improve this acute care transfer rate and that fall rate makes me really just happy that we did that, because those are patients that are people that have families, that have husbands and wives and kids and grandkids, that might have gone back to the acute care hospital and they didn't, which is a bad thing. If you get that,
Sure.
it's not good for the care. So that one just stands out. We do about 263,000 discharges a year, and if you can
And
lower that by 1%, that's what, 2,600 people, right? And
yeah.
we've done more than those things, and I just, it makes me feel good. Now, the best thing we've done with it is we've reflected that back into our culture, that
Mm,
you guys are affecting clinical care by giving them the tools that they need, not just an EMR where we're putting data in so that we can,
sure.
use it as a longitudinal patient record and so that we can get paid. We're
I was
using the
gonna say,
data out of that thing to make stuff good, both for the patient as well as a clinician. So they're surfacing things with this algorithm that they might not have been able to discern because there's so much stuff in the EMR.
yeah, absolutely. I'd love to hear your perspective on what I think is one of the greatest challenges of a CIO, and that's balancing things like strategy and team development with the other side, which is like all the operational challenges that you face. I like to describe them as the fires that have to be put
Yeah.
out and show up every day. Like, how do you balance that as a leader, making sure you're doing strategy and you're being strategic and, the operational minutia of an organization?
Yeah, that is the most challenging part of the job. Um, just from the perspective of and sometimes you need a different mindset to do different things. So there's the strategy thing, and then there's let's just keep the lights on thing. And, so Gartner used to say they had some kind of term for it, but essentially you bifurcated your IT group. And it's like, okay, well, the cool kids get to go over here and do strategy, the architecture and all that stuff. And meanwhile, I'm grinding it over here on the server, the security desk or whatever. So I never adopted that because I wasn't a programmer or anything, but I had an IT background, and that didn't mean I couldn't do strategy. So I've tried to put the teams together that can do the particular strategies within their group that matches the strategy of the bigger group that matches the strategy of the organization. And I'm the arbiter in between that and the VPs that work for me. So this is what we're thinking about doing. We're going to put in this clinical thing. So we started doing dialysis, and that was one of those things that we hadn't done before, and it's a wonderful thing for our patients. So we wanted to do that. Well, how do we get there? We got to design this architecture to support it. The things are on the network now, all of that, and so that keeping people in both camps lets them reflect on, I am, not just a button masher. My brain is working for the company too, but I also get to keep the skill set viable and valuable that I like, which is, the IT stuff. But there's times, right, where it's full throttle one way, and then you let off the throttle. Hopefully, we work pretty fast around here. Infusion for us, we were full throttle for 18 months, and we're taking a little bit of a break now. But then we got plans in a couple months to stay on the throttle, get back on it.
Yeah. I mean, that's how we are. Full throttle for vibe and hymns, and then we take it off a little.
Yeah. I like to run cars fast, and one of the things you can't do. So if you're coming up a hill and you're scared because you're coming up the hill, you can't see the future, you lift off the throttle. When you lift off the throttle, what does the car do? Stretches its shocks out, it gets unweighted, and then it loses traction. Pow, you run into the wall.
Yeah.
You're coming up the hill, you just stay on the throttle. Keep
Yeah.
mash down, and then you react as you crest the hill. Don't react before you know what's out there.
Yeah. I love that analogy. As we kind of wrap up here, a couple more things. One is, Is there a topic that isn't being talked about enough right now that you think really deserves more attention? There's so much going on. There's so many shiny objects, I'd say right now. Is there something that's maybe not a shiny object that you're like, geez, we should spend more time, talking about this, addressing it?
Yeah, and we've talked about it here.
Mm,
It's the people
mm,
because I think the technology is going to come to us and we're going to need the people to be able to discern this is going to work, and all of that. So their skills are going to need to adapt, and we need to first of all make sure that they're comfortable in our strategy so that they're able to make those transitions. So
mm.
um, I'm not seeing that yet, but that's what I think. We all are still keeping the lights on EMRs and websites and all that kind of stuff. But they're coming for us in terms of the capabilities that are out there. We're going to be buying much more stuff than we're making, and I think it turns us into, instead of a builder, we're kind of an orchestrator of the orchestra out there. Some of them will be your stuff and some will be other people's stuff, but the CIO has to be that orchestrator, to keep all that. And we've always been that, but it's different now, I think, because the capabilities of this tool are so are so wonderful, and the potentials for you know tough stuff that you don't want to deal with are there too.
Yeah. It's almost like we went from a little four-piece quartet to a full orchestra that we need to orchestrate. That was my
Playing
take coming out of
Metallica.
him. Oh, what?
Playing Metallica.
Yeah, that's fair. Well, and you may have to play Metallica one day, and you got to play, some John
They-
Williams the next,
yeah,
right? Like,
that's
that's
true.
the interesting challenge. Yeah, that theme of orchestration has, to me is something I'm hearing more and more of. And whether that's a tool that helps you orchestrate, or like you said, it's your IT people orchestrating all the tools to be able to, facilitate the care. I think that's going to be a really hot topic over the next few years, I think.
Yeah, for sure.
Yeah. Well, as we wrap up, we always like to end these episodes with some career discussion, career advice. I think a lot of people would love to hear your perspective. Like, what advice would you give an aspiring CIO out there that wants to be the next Rusty Yeager?
So that you, first of all, don't try and
Don't
be
be
me.
Rusty.
That's a lot of work that you don't have to do.
Learn this little lesson so you don't have to be make your
Yeah, you
mistake.
just
That's
watch my
humble of you.
career. I think, well, why don't you just ask AI?
Just ask AI.
And I did that, and
Hmm.
it didn't really. It gives you some good ideas,
Hmm.
but I think the aspiring CIO needs to reflect, if you want to be IT focused, being a healthcare CIO is probably not the right career move. I think if you want to be a business person that understands how to use IT to leverage better healthcare, cheaper healthcare, those type of things, be conscious of the business of healthcare. I mean, it's over 20% of our GDP, and that's unsustainable for the future. We're going to have to get leaner, meaner, more efficient, to support our country. And that's, ultimately that's going to change the system that then the IT sits. And then you've got the AI coming in on that, doing a lot of the work that people were doing. So I would be angling to, less, less, less in the IT camp and more in the business camp, especially if you've got a long career in front of you.
Yeah, absolutely. Well, Rusty, last I checked, I think your last episode with us on the CIO podcast was the most listened to episode, and I have a feeling this one may compete with that and take it down. So I appreciate you taking time to talk with us and share your experience and insights. And congrats to you on an amazing career, and being able to impact so many patients and so many in your organization. So I appreciate you taking time to talk with us as you kind of wrap up your career.
Well, thank you, John, and thank you guys and gals that are out there watching this for doing what you do every day because you're supporting your patients. And if you're, a partner, not a vendor, you're helping us too.
True.
So thank you guys all so much, and hope to see you at Fives, Chime, Him, whatever in the future.
Yeah, I'm sure you'll still stick around. It'll be interesting to see what you do
Man,
next
that's
time.
going to be one thing I'm just going to miss so much is the week at those things and the things we learn together. Like I tell my successor, there's so much you can learn from other people, build those relationships, and y'all do it too.
Absolutely. Well, thanks, Rusty, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks so much, Rusty.
Thank y'all.